Whether it's painful kidney stones, fertility issues, or even prostate cancer, there's one thing that men can do to ward off these health issues and many more. Joining us today to talk about the importance of regular urological exams is Dr. Jamin Brahmbatt from the Orlando Health Medical Group Urology. Thanks so much for being here today.
Thanks for having me.
Okay, so we know that a lot of men over the age of 40 are going to have some kind of urological issue.
Yeah.
The problem is they don't go to the doctor. Why?
The hardest part is getting them through these doors. And we actually, through Orlando Health, did a survey a few years ago where we actually surveyed over 1,000 men across the country looking for what are the biggest excuses they have. The number one excuse was they don't have enough time. The second excuse was they're afraid of what I'm going to tell them when they come and see me in the office. And the third most common excuse, which I thought was the most revealing to me, was because I thought it was something very simple, was actually my examination. They were worried about what I would do to them when they're in the room, especially when it comes to urologic exam and checking their prostate.
Okay, well, let's break that down a little bit, and maybe we can help men understand it's really not that big of a deal. What happens when they come to see you?
About 80% of the time, it's not even going to be surgery. So a lot of people assume because the walls outside say urologic surgery, they're going to come in here and they're going to need some procedure or some surgery. That's not the case. When it comes to enlarged prostate, a lot of our treatments deal with behavior changes. They may even involve maybe trying some supplements that are natural, and then perhaps some medications. When it comes to kidney stones, a lot of the kidney stones, patients can usually pass on their own, so they may not even need a surgery for them. When it even comes to things like erectile dysfunction or low libido or sexual drive issues, there's lots of things that we can do without having to actually start medicine.
Right. What is the most common problem you treat here?
Men in their 30s and 40s will either come and see me for family planning, so discussing vasectomies, erectile dysfunction, or low libido. That's in the office.
Right.
In the emergency room, usually it's for kidney stones. And as they get older, we may start seeing them more for enlarged prostate issues, so trouble peeing during the day or at night, or blood in their urine.
Right.
And then there's a whole workup that happens with that to make sure that they don't have any urologic cancers.
Because urology isn't just about those areas that we find embarrassing to talk about. It's your bladder, it's your kidneys, it's a lot of your internal organs are involved.
Yeah, and it's not just for men. We actually take care of men and women. So 40% of the patients that we see are actually women, because women get kidney stones. Women have issues with their kidneys when it comes to cancers. Women can have issues with incontinence or urinary issues. So everything that we deal with in men, about half or more we actually see in women as well.
It's another reason to choose well with Orlando Health. If you would like more information, you can visit orlandohealth.com/urology.